Welcome to tonight's webinar. My name is Melanie McKinney, Programs Coordinator for CAN-DO Multiple Sclerosis. Thank you for acting on the belief that you are more than your MS by attending tonight's webinar, Pain Management for People Living with MS, with CAN-DO MS Programs Consultants, Dr. Janice Miller, Dr. David Engstrom, and Susan Anaker, MS-PT. I want to start tonight's presentation by talking a little about CAN-DO Multiple Sclerosis. CAN-DO MS is an innovative provider of lifestyle empowerment programs for people living with MS and their support partners. We are the start of a whole new way of thinking about and living with MS. CAN-DO MS empowers people to move beyond their MS by giving them the knowledge, skills, tools, and confidence to adopt healthy lifestyle behaviors, actively co-manage their disease, and live their best lives. In 2010, CAN-DO MS launched its new website, www.mscando.org. Please visit the website where you can register for upcoming webinars, listen to archived webinars, check out our CAN-DO MS lifestyle empowerment programs, including our upcoming CAN-DO 4-day programs and Jumpstart 1-day programs. Share your CAN-DO promise and learn ways you can contribute to or get involved with CAN-DO MS. A few housekeeping items before we get started. Our presenters will address questions and comments at the end of the presentation, and we will encourage questions and comments throughout the presentation. To ask a question, type your question in the chat feature located on the left of your computer screen. To submit a question, type in the small box that says Chat with Presenters. This presentation is being recorded and will be archived on CAN-DO MS's website. You are more than welcome to view the presentation again, and if you've missed one of our other webinars, you can find the archived version on our website. For those of you who are attending live tonight, you will receive an email tomorrow with copies of this PowerPoint presentation. As many of you discovered when you logged into the webinar, new in 2011, you can listen to the live webinar through your computer speakers rather than having to call in. So the job of the live participants, so to speak, tonight is to 1, submit your questions and comments in the chat box, 2, complete the evaluation at the end of the webinar, and 3, review the webinar schedule and register for the upcoming webinars. And we have 3 great speakers lined up for you this evening. Dr. Janice Miller is an experienced neurologist with Associated Neurologist in Boulder, Colorado, and she also has admitting privileges for Boulder Community Hospital. Her special interests in neurology include multiple sclerosis, movement disorders, stroke, and women's issues. Dr. David Engstrom is a clinical health psychologist with over 25 years of experience working with people with MS. He has authored many publications and is an active public speaker. Dr. Engstrom helps people with chronic illnesses, weight management, motivational coaching, and stress and pain management. And Susan Anaker received her master's in physical therapy from the University of Minnesota with a focus on balance and falls prevention. As the original rehab manager for a major Minneapolis home care agency, she has over 30 years experience in home health care serving MS and chronic disease patients. Now before we start tonight's presentation, we'd like to do a quick survey to get a feel for who's on the webinar with us this evening. And I just put a survey up on the screen, and we'd like for you to tell us a little bit about yourself. First, are you a person living with MS, a support partner, a healthcare professional, or other? It appears that the majority are people living with MS, and we do have some support partners on the call, so that's great. So now we'll get started with our presentation. And first will be Dr. Janice Miller with pain management from a neurological perspective. Thanks so much, Janice.
Thank you, Melanie, and good evening, everyone. Thank you very much for joining us this evening for discussion of pain management in MS. I'll be the first presenter tonight, giving you the neurologist perspective on pain management in MS. Next slide, please. Until recently, pain in MS has really been underemphasized and I believe undertreated. But we now know that MS, in fact, has pain as a very prominent symptom. Some estimates say that between 50 and 75% of people with MS experience pain during some time of their illness. And a sizable percentage of these people have chronic pain, which is defined as greater than 3 months of continuous pain. But I believe that pain can be one of the most successfully treated of MS symptoms. I believe pain is best treated by a holistic and multidisciplinary approach. That's why you'll be hearing from 3 of us tonight. I believe that we need to get to the bottom of the source of pain. This is usually an easy task with a good history, a neurologic exam, and input from physical therapist, occupational therapist on posture, muscle tone, biomechanics. Our hope is tonight that we will give you a toolkit to help manage your pain and to encourage you not to allow your pain to be ignored or undermanaged. Next slide. Next slide, please. Pain, if poorly treated, can set up a vicious cycle. Pain can lead to anxiety and depression, which in turn can cause sleep disruption and in turn increase fatigue, decrease physical activity, increase muscle tone, and overall cause more pain. Pain also affects your work life, social life, family life, sex life. Next slide, please. Tonight I'm going to discuss 2 categories of pain that is common in MS, nerve pain and musculoskeletal pain. Both of these may be either acute or chronic. Migraines, surprisingly, are more common in MS. I won't be discussing these tonight, but I'd be happy to answer any questions later. Next slide, please. Nerve pain, also called neuralgia, is a very distinct type of pain which has many descriptors: burning, pins and needles, a tight band around the trunk or an extremity, burning Coca-Cola in your veins. It is, we believe, caused by a hyperexcitability in the demyelinating nerves in MS lesions, either active lesions or sometimes even old lesions. A particular example of demyelination in the brainstem is trigeminal neuralgia, which is a debilitating facial pain. Next slide, please. Next slide, please. We have a number of proven effective medicines for treating nerve pain. The first group I'm going to talk about are anti-seizure drugs. The same drugs that we use to treat seizures also are very effective in nerve pain. Carbamazepine is one of the oldest members of this class used. While it's still effective for trigeminal neuralgia, we don't tend to use it as much simply because the side effects, the need for blood test monitoring is higher. Gabapentin or Neurontin and pregabalin, which is Lyrica, are probably the most commonly used in this class. Both work best when given on a scheduled basis, usually dosed anywhere from 2 to 4 times a day, or if there's pain only at nighttime, then simply at nighttime. My motto with these medications is start low, go slow. Lowest dose, start slowly. That way, most people are able to tolerate these medications without side effects. Topamax is another medicine which is very effective in nerve pain, but in some people it can have cognitive side effects, so I generally do not use this unless an individual is blessed with both nerve pain and migraines, because this is a very effective migraine prevention medication. Levetiracetam and lamotrigine are just being studied now for nerve pain. The antidepressant group of drugs, particularly the group called serotonin norepinephrine reuptake inhibitors, such as venlafaxine or Effexor and duloxetine or Cymbalta, are also very effective. These neurotransmitters are important in the pain inhibitory pathways. Tricyclic drugs are older drugs, and while they have the advantage of just once-a-day dosing, they are more sedating. So I will use those maybe in low doses at bedtime if there's a concomitant sleep problem. Tramadol is a drug in a class by itself. It is a drug that can be used either as needed or on a scheduled basis. Narcotics are not first-line drugs, but I don't think they should be avoided if individuals cannot achieve pain control with first-line drugs. Topical anesthetics are drugs that are delivered in a patch or a gel, usually lidocaine or similar substances. They're really good for limited area pain. And then finally, pain that's related to an acute demyelinating lesion usually responds to steroid therapy. Next slide, please. There are a number of non-pharmaceutical approaches that I think are very valid. Acupuncture and acupressure, TENS, which is transcutaneous electrical nerve stimulation. This is a small battery-operated device that delivers small currents through electrical patches placed on the skin and essentially short-circuits pain pathways. Biofeedback is a technique in which one learns to decrease one's body's response to pain. And then radiosurgery or gamma knife is a specific tool for trigeminal neuralgia, which does not respond to medications. Next slide, please. So again, there is a vicious cycle. Nerve pain can cause muscle tension, reduce circulation, shorten muscles, cause muscle pain, and again, cycle back and cause more nerve pain. Next slide, please.
Janice?
Yes.
Hi, we lost you briefly there. I don't know if there was an issue with the sound.
Yes, I heard an echoing for a while, so I'm back online. So
okay.
Now I want to focus on approaches to more chronic pain. We will often use the same treatments, the same medications, but it really requires more of an ongoing detective work, evaluating the muscles, joints, connective tissue. And this is why you also want to have a physical therapist in your pain toolkit. They will pop out of the toolkit like a magic genie and give you a lot of tools to help with this. Susan will be speaking more of this later in our talk. Massage and other manipulative therapies such as chiropractic treatment, TENS, again, water therapy, shiatsu are all very helpful tools. Meditation and relaxation exercises. Dr. Engstrom will touch upon this later on in the talk. For the last few moments, I would like to talk about medications, yoga, and acupuncture. So we now have a fair number of medications on the menu for chronic pain management. The problem, as I see it, is that it's truly a balancing act to find a medication on the right dose that will treat your pain without making any other MS symptom worse, such as constipation, cognitive function, balance, fatigue. This really requires, I think, a lot of feedback to your neurologist about side effects. Rather than simply stopping a medication, give feedback. There may be dosing modifications or things that can be changed to decrease side effects. Anti-seizure medicines, the tricyclics and SNRIs are helpful. And a tool that I like to use is compounded medications, where I have a compounding pharmacist actually make a pill form of a medication such as gabapentin or an anti-steroidal medicine into a topical form. This is a nice form of pain relief for more localized pain. Muscle relaxants such as baclofen or tizanidine can be very helpful when muscle pain is caused by increased tone. And then narcotics. They're on the bottom shelf of our toolkit, but they're on our toolkit nonetheless to be used as needed. Next slide, please. Yoga and meditation are two powerful mind-body exercises that can be modified for everyone. There are now MS-specific classes for yoga and many books and DVDs specifically targeting MS symptoms, including pain. Both have been shown to decrease the amount of pain that we actually perceive. And recent research has found that they're even more effective than simply relaxing or being distracted from our pain. Next slide, please. Acupuncture is one of the oldest pain treatment modalities known to man. It involves inserting very thin disposable needles along the body's meridians or energy channels to alter the flow of energy. It may take up to 10 sessions of acupuncture to know whether it's helpful for any symptom. A large majority of MS patients have utilized acupuncture for symptoms including pain, and a large majority have found improvement with acupuncture. So far, we do not have any large studies in MS populations, and the role of placebo in acupuncture is a little unclear. There are some studies which actually show that real acupuncture and placebo acupuncture are not that much difference in their outcome. And finally, we don't know the effect of acupuncture on the immune system in MS. The World Health Organization, the National Center for Complementary and Alternative Medicine, and the National MS Society are all actively involved in acupuncture research in MS, and I would encourage you to check their websites if you're interested in this topic. Next slide, please. Here is my bottom line message. You want to partner with practitioners who are both interested and experienced with pain management and MS. Don't have the source of your pain investigated. Don't assume that all pain is MS related. Add topical treatments and physical modalities whenever possible. Use the lowest dose of the most effective medication. And remember, each individual responds to a particular treatment differently. Finally, address the emotional aspect of your pain. Don't be identified by your pain. Next slide. Like Nancy Reagan said, just say no to pain. Thank you so much for your attention, and I'll be happy to answer any questions at the end of the presentation.
Thank you so much, Dr. Miller. And I just wanted to clear up. I apologize for the issues with the slides. We think it was trying to pull back to the polling slide, but we've worked on that problem. So sorry for the confusion there. And again, all of the participants who are here this evening will get a copy of the slides tomorrow. So I just wanted to let you all know that as well.
Thank you, ma'am.
And thank you. And now we have Dr. David Engstrom, who is going to speak on the psychological aspects of pain. Thanks so much, David.
Thank you very much, Melanie, and good evening, everyone. I want to start with just describing pain a little bit because pain is very complex, and I think it's important to understand. Next slide, please. As you've already heard, there are really two types of pain, but they sort of mix a little bit. There's acute pain, and we all think of acute pain. If you break your arm, or if you have something serious go wrong with your body that can be fixed in a fairly short time, generally that's the way acute pain works. Chronic pain is the kind that lasts for a long period of time. However, duration of the pain is really much less important than how we deal with it. And here are the three real clues to how we deal with pain. Number one, there is the basic pain itself. That is the amount of pain that you feel during the day. That's very separate from how much we suffer from pain. There are a lot of studies that show that people who have fairly serious pain conditions suffer a great deal, and some other people don't suffer very much at all. Now, why is that? I mean, it has to be a psychological barrier there. And the third part is how much we're disabled by our pain, how much our pain actually makes us feel like we can't do things we normally do. Next slide, please. Remember, if nothing else from my presentation, that pain is very complex, and it's an experience. You know, there's no real way to objectively measure pain. The only way to measure pain is to ask people how much they hurt. And it's not influenced just only by tissue damage and underlying pathophysiology, whatever that might be, but it's often influenced a great deal by the way we think about pain, the way we feel about pain, and the way we act, our behavior around pain. Very important concept. Next slide. As you've already heard, it is estimated that as high as 65% of people with MS have significant pain. Now, nobody can quite sort out how much of this 65% are people who experience pain because of MS or who have pain in conjunction with MS. So some people can have pain and MS at the same time. But again, some of the common syndromes that are seen by doctors who see patients with MS with pain, acute pain, number one, trigeminal neuralgia, optic neuritis, and neuralgia. All three of the different kinds of neuralgias can contribute to this. In terms of chronic pain, people often have musculoskeletal pain, joint pain, dysesthesias that go on not for just a couple of weeks, but a couple of months, a couple of years, and often well into their lives. Next slide, please. The first point I want to make is that the way you think about your pain has a big effect on how bad your pain will feel and what your pain level will be during the day. And some of the things that I've come up with, I call unhelpful thoughts. These are thoughts that we all have when we have pain, and I've experienced chronic pain in my life. I know exactly what it is, that don't help us very much. Number one, unhelpful thought, I'm helpless to manage my pain. I can't deal with my pain at all. I can't do anything to eliminate my pain or reduce my pain. A very common unhelpful thought. The next kind of unhelpful thought, I'm sure we've all had. You know, if you wake up at night at 2 in the morning and the bedroom is dark and quiet and you start to think, almost all your thoughts usually gravitate toward the what-if thoughts. What if my pain gets worse? What if my MS symptoms get worse? All those different things multiply in our heads sometimes. And misfortune telling, I think, is the very basis of anxiety. That's where our anxiety comes from, is all those thoughts we have about what if, most of which aren't even true. The next unhelpful thought is called all or nothing thinking. I'm either totally pain-free or I have horrible pain. It's that idea that we get in our head that we're either totally dealing with it just fine or it's horrible and it's really disabling us in a lot of ways. That's an example of sort of that black and white all or nothing thinking pattern we get into. Another one that I think is quite common with all of us is disqualifying the positive. You know, you might have a day in your life where you've done 95% of everything perfectly to deal with your pain. But maybe 5% of the time you overexerted yourself a little bit, You went a little bit too far, and as a result, that's the thing you always think about. We tend to disqualify all those things in our lives that we do that are really positive things. Next slide. I can't emphasize this enough because I'm a big believer in it. When I see private patients and when I see patients in groups at hospitals, I always really emphasize the importance of your coping skill of writing things down. Self-monitoring is crucial. It's been shown in many studies that people who record different things in their lives tend to be able to change those things a lot easier. So what I'm going to suggest to you tonight is a very simple start, is every day look at 4 different things. Number 1, figure out a way to rate your pain. The easiest way, and the way most pain centers use, is a 0 to 10 scale, where 0 is absolutely no pain and 10 is the worst imaginable pain. Try to rate your pain on that scale every day. I don't ask you to spend a lot of time thinking about pain, but at least for a minute each day think about what it's doing to you. The next thing is measure your activity level. This maybe hasn't been discussed quite as much as it should be, but you know, it is important for people to stay active. Almost all the studies show that people who have non-malignant pain, that is pain that's not due to cancer directly, do better if they are more active. So you might want to think about some way of recording how active you are during the day. The 2 suggestions I have, number 1, there's a really nice little high-tech gadget you can get called a Fitbit, and I have no interest in this company, but I will tell you that it's a little gadget that looks sort of like a Bluetooth that you clip in your ear. And you can clip it on your pants, you can clip it on your shirt, and all day long it measures how active you are. And every time you walk by your computer, it wirelessly records your activity for the day. If you want to go to a simpler format, just a simple pedometer. You can get this at Target or Walmart for $10. Go get a step pedometer, something that just measures your number of steps per day, assuming you're ambulatory, and record that every day. The third thing you ought to log for sure are your emotions. How you feel every day. How much distress do you feel? You might decide, if you are susceptible to depression, to rate your depression from 0 to 10, just like we did with pain, or your anxiety and stress. And lastly, because I think it's so important, look at your total sleep time. Sleep is incredibly important. And you know, most doctors that work in sleep centers will tell you that the average American gets about 6, maybe 6.5 hours of sleep. We all need at least 7.5 hours. Sleep is healing in many ways. And there are so many studies coming out these days, even about advantages of sleep over exercise, that you really need to pay attention to that. So, pain level rating, activity level, what your emotions are, and total sleep time. Next slide. Here's the one that I suppose most psychologists focus on the most. Another way to apply your coping skills. Learn the value of relaxation. As Dr. Miller has already pointed out, when we get pain, our natural body response is to tense up our muscles. When we tense our muscles up, our blood flow slows down and we don't heal as quickly. So it's really important to learn one of these 5 techniques or any other. The first one that I use with a lot of patients with pain is simple passive muscle relaxation. Learn to identify the areas in your body that are tense and try to slow them down in terms of tension during the day. A body scan is another very interesting technique that works extremely well, where you just basically, if you're lying down or sitting down, just take a simple scan of your body, all the different muscles in it. You don't have to do anything, but just notice any tension. Breathing exercises are extremely powerful, and many people have realized that. I think any woman who's had a baby knows the first thing they teach you is how to breathe properly. Breathing is important, and there are a lot of good breathing exercises available, including things like circular breathing, where you simply breathe in through your nose, hold for a couple of seconds at the top, and breathe out through your mouth. Visual imagery is a very important concept. If you're good at closing your eyes and going to that beautiful beach that you've seen on a travel video, or maybe been to in Hawaii or someplace, and you can just see yourself right there and you can feel the warmth, that's extremely important. And the last one, I'm not going to spend a lot of detail on it, but there's a lot of research in the last 15 years on mindfulness meditation. It's a very current topic in meditation, and all it requires you to do is to be still, physically still, and to be present. And being present is the hard part because we always have these intruding thoughts that are coming into our mind. So you might think about picking up a book or something on mindfulness meditation. Very useful. Next slide. Activity pacing is extremely important. Again, another way to apply your coping skills. Think about your day. Think about your average day. Are there ways you can go a little bit slower during the day? Because we all know that quick, erratic activity will often bring on pain. Are there ways you can take breaks during those periods where you're experiencing a lot of activity? And to maintain a steady pace, to keep going at relatively the same pace all the time. And of course, lastly, is just breaking your tasks into little manageable pieces. If you have a closet to clean out, you don't have to clean it out all at once. Think about it as 5 or 6 or 10 different little steps, little manageable steps. Remember, the key to staying motivated is to keep things small and simple. Next slide. Bottom line, pain is influenced by your thoughts, activity, and positive emotions. And I think that's very important to remember. There's so much research these days on the effect of optimism on our mental health and our physical health as well. I can certainly, if you're interested in emailing me, you can always get a couple of books that are very influential in looking at positive emotions and optimism. But the more we get negative about things, the more our pain gets worse, the more we feel slowed down. So think about how you can be optimistic every day about accomplishing little things. I've just left you with a couple of resources. The first is a pretty good YouTube video on the idea of chronic pain. And the second is a link to Fitbit if you're interested in getting that device. And the third is a really nice workbook if you're interested in spending a little bit of money. I don't think it's very expensive, but it's on a workbook about how to use cognitive behavioral therapy to treat chronic pain on your own. So I think those are all very important things to do. So I thank you very much, and I notice the last question that we have in the chat is, not all pain is in our mind. And I have to respond to that. You're absolutely right. But nothing that we experience as pain doesn't go through our mind. Everything we experience ends up being a mental phenomenon. Thank you.
Thank you, Dr. Engstrom. We really appreciate you presenting this evening. Now we have Susan Anaker, MSPT, and she will speak on physical therapy and pain management. Thank you so much, Susan.
Hi, welcome to all of you. I'm excited to meet with all of you and to share a few of my favorite ideas about pain management. I'd like to talk with you about physical therapy ways to better manage your health and in this way to lessen any pain you may have. Sometimes pain management and MS can seem like a daunting journey, like this hiker on the left. The path may seem impossibly steep and difficult. I want you to leave today with 6 concrete ideas for managing your pain. I hope when you have had time to implement these ideas, your path will be smooth and you will be focused on the beauty of life, like the hiker on the right. So here are the 6 ideas we will consider tonight: cold, stretching, massage, exercise, posture-based pain solutions, and listening to your body. Let's talk about cold. Using an ice pack to decrease pain can be quite effective. It works by decreasing nerve conduction and decreasing inflammation and swelling. You can use an ice pack, you can use a cooling vest, or even a bag of peas. Pain relief studies show peak effect at 15 minutes. Then you're probably best to move on to another pain control method if necessary. So get out your pain toolbox and put into it this tool shown in the green box. Ice pack, 15 minutes. Next slide. Stretching. Stretching for pain relief is done by stretching the affected area and holding it for a count of 30, like 1 1,000, 2 1,000. Repeat this 2 times for each stretch. stay in the ouch-free zone. Stretching works by elongating individual muscle fibers to help relieve muscle spasm and reset the sensory receptors in muscles and ligaments. Stretching joint ligaments also return you to your 20-year-old self or your best normal. You may have had stretching exercises written for you by a physical therapist, or you may have gotten them from the MS Society stretching pamphlet or from some book such as Bob Anderson's stretching book. Muscle length and flexibility are not something that can be restored in one day or 1 week. It took months to get stiff, and it will take weeks or months to get more flexible and less painful. You can, you will, and stretching has no side effects. So get your toolbox, and the green takeaway is stretch, hold 30 counts, 2 repetitions daily. Next slide. Massage. I think you're all familiar with massage. Massage could be something your family or spouse help you with, something you have a professional do for you, or something that you do yourself, like massaging your feet. Massage works because you are stretching the muscles and ligaments as you massage. This decreases muscle spasm and increases circulation to the area to decrease swelling. Massage also provides non-painful sensory input to balance the system. Massage feels good at the moment, but doesn't have nearly the long-term positive effect on pain that stretching or exercise does. It is another tool, but not the only tool to try. So get your toolbox and put in massage, another tool. Before we talk about exercise, I'd like you to answer a short question for me. How much time do you spend exercising each week? Like if you spend 5 minutes on Monday and 15 on Wednesday and 35 on Saturday, add that all up. So go ahead and answer for me, and we will get back to the results in a few minutes. Next slide. Exercise strengthens your muscles so your body can work properly. It increases positive endorphins to your brain. It increases your metabolism and your positive mental outlook. There are many choices for exercise. The first group of my favorite exercises are those that promote good posture. These are yoga, especially adaptive or gentle yoga. You can see that in the photo on the top left, and I'll have you note that the yoga instructor here is the gentleman on the left side in the wheelchair. Second, Tai Chi, especially Tai Chi Cha and Tai Chi for arthritis. There's an example of that in the top right photo. Also Pilates, especially Stott Pilates or any gentle Pilates, and even ballet, again, especially gentle ballet. The second group of exercises is what I would call reciprocal exercises, reciprocal as in right, left, right, left. Examples of this are walking, bicycling, and swimming. The last group of exercises is low impact, for example, pole hiking and some types of dancing, not running, jumping, or martial arts as in hitting martial arts. Can you back up one slide and we'll look at the results of our questionnaire? Again, we were asking about how much per week you exercise, and I see that we have an interesting breakdown. Some people are at 0 to 30 minutes. Bravo, you're exercising. Great. And some people seem to be enjoying it a lot, and they're way above 120 minutes. So all sorts of different answers. That's great. The best exercise is the one that you will do. Work first for consistency. I would recommend exercising 6 days a week with 1 day off for rest. Then gradually increase the time from even as little as 5 minutes per day up to 30 minutes, 45 minutes, 60 minutes per day. So you may start out 6 days a week, but only 5 minutes each of those days. The key is finding the joy in movement. Look for the sweetness of motion. So get your toolbox and add in move. 6 days a week, 5 to 60 minutes per day. Find the joy. Next slide. Now we're going to talk about posture-based pain solutions. Prolonged poor posture stretches ligaments and muscles which cause pain over time. Muscles and ligaments shorten on one side, overstretching on the other, which results in bad posture. This causes pain and increases work for your body. Let's look first at bad forward flexion of the neck and spine. Can you go back one slide, please? Thank you. First, let's look at the curve of this man's spine on the left as he works at his computer. Compare it to the photo on the right. He's much straighter. He will have less pain at night and less pain the next morning. Note that he did this by changing his computer. You can do that too. If you have a bad setup, you need to change to get better. Next slide. Look at the curve of this man's spine when he's computing in bed. This is comfy at first, but painful later on. Change your environment to have less pain. Look at how this gentleman changed. He got his spine upright and against the back of the bed, and he used pillows to bring the computer up where he could see it better. Next slide. This young lady is watching television, and again, look at her spine on the left. Use pillows behind your back and a footstool. Change your environment to be less painful. Next slide. Previously, we were talking about examples of flexing your spine forward. Now look at what I would like to call asymmetrical bad posture. In other words, postures where you're always on one side. Now, I work in home health care, so I have been to your house, and I know that you have your own side of the bed, like this woman on the left. She reads only with her right side up, because that's where the light is. She will be sore in her left neck and her left shoulder. Similarly, this man is leaning way left because his desk is cluttered. Again, this woman has her side of the sofa, so she is overstretching her trunk on the right side. Watch for your posture patterns. Change your environment. Get out your toolbox. Be tall. Be centered. Next slide. Listening to your body. One of my college-age kids wants to buy a used car with a broken gas gauge, and he wants to know, is this a problem? So, is it? Do you want to know when you're about to have a really big problem? I sure do. That's what pain is. Pain is a gas gauge that says, you're starting to have serious trouble here. Pain is your friend, your messenger, so listen. And when it tells you, hey, my neck is sore, look for the pattern. When? Why? What makes it better? What makes it worse? Then use this information to change. So, listen, look for the patterns, change. So here is your pain management toolkit. Try these 6 tools or ideas, and you will be on your way to feeling better. Copy them from the slides after the webinar and post them on your bathroom mirror or your coffee pot where you will see them and give them a try. Then let me know how you do. Thanks for joining me tonight.
Thank you much, Susan. That was wonderful. Before we move into the question and answer portion, we do have one additional polling question for you. And this one is just kind of a follow-up to the webinar. How confident are you that you will be able to manage your pain more successfully in the future? Extremely confident, somewhat confident, not very confident, or not confident at all? And if you don't mind taking a moment to answer that. Looks like the majority is somewhat confident. That's great. So yeah, thank you so much. And let's go ahead and move into the Q&A portion. And I'll start with this first question. How can I distinguish between spasticity pain and cervical degenerative disc disease? And this might be a question for Dr. Miller.
I'll start with this, and Sue may also have some additional ideas. Well, first, your neurologist with a good exam should be able to determine that by looking at your muscle tone, your reflexes. Cervical disc pain often produces what we call radiating symptoms, symptoms that travel down your arm or into your hand, may be relieved by different postures or exacerbated by different movements.
Do you have anything to add to that as well, Susan? Or
I would like to add that and ask you to not overlook the influence of posture as well. You may have more than one influence on your pain. So you may have indeed radicular pain, but it also may be influenced by the way you read in bed at night, or the way that you sit, or the way that you are at your computer, or how you are when you drive. So add that as well.
Thank you. Another question we have is, I get burning pain in my feet, and they are constantly red. When I touch them, they briefly turn white. I don't know if this is one that you all can answer, or if this might be a stumper.
Sure. Let me start. And again, this is one of the examples of don't assume everything is MS-related pain. People with MS can get peripheral neuropathy or peripheral vascular disease, or both. So again, a good neurologic evaluation should tell us if this is neuropathy pain, meaning it's the opposite end of your nervous system from MS, the nerve endings in your feet. Peripheral neuropathy is often symmetric, getting both feet at the same time. So I would really look to see if there's anything else going on rather than MS pain.
Okay. Does anyone need to add to this? Or
You could try cold to your feet and see if that's helpful or not. But again, I think Janice has the right idea, the primary solution.
Thank you. Additional question we have here. I recently started walking for exercise. I have severe pain when walking. Are there any tips to be able to continue walking but with less pain? This might be
I'd like to address that. I would start by looking at your shoes and make sure that you have good supportive shoes that hold your feet in good alignment. Some people do pole hiking, by which I mean walking with like ski poles. It will take some of the weight off of your legs, some of the stress off of your feet and legs, and you might find that helpful.
Great, thank you. Another question here is how I have a high tolerance for pain. I'm very active throughout the day. I work part-time and live with chronic pain. I can't write things down when my hands are in pain and spasming. It's hard to apply everything. Whoops. My apology. That end of that question was cut off. The nerves that flared up during shingles seem to be acute at times, and my doctors say it's caused by MS. Is there an agreement with that or any feedback on that?
It sounds like a couple parts to that question. David, would you like to address the first part?
We may have lost him with sound. If you want to
Okay.
go ahead and go ahead with your portion.
Tell me again, if you could repeat the second part of the question about shingles.
The doctors believe that it may be caused by MS or worsened by MS, and I'm just wanting to get some suggestions or feedback.
Yeah. Again, I think this is the time to start with your neurologist. I think there's a lot of easy things that we can do to sort out MS-related pain versus non-MS-related pain. It's hard to give an overall generalized answer, but I think this really needs addressing by your neurologist.
Certainly. Another good question that we have here is, what about buying and replacing one mattress? I guess as a form of relieving pain.
I can chime in a little on that, since I do a lot of classes on sleep management. We spend 1/3 of our time in bed, and most of us are cheapskates about mattresses. And my recommendation, if you can afford it and if you can do it, get the best mattress you can every 7 or 8 years at the very maximum.
Does anyone else have an additional comment?
I think that's a very good suggestion, David.
Thank you so much, David.
Sure.
Another question we have here is, what can I do for severe leg spasms at night? Sometimes I have to sleep in a fetal position because the pain is so severe.
I'll start with that question. I think that would be a type of pain that would respond well to gabapentin or Neurontin. This is a medication that can be really dosed up at nighttime because fortunately it has a short half-life, meaning when you wake up in the morning, you will not have any medication hangover. Lyrica would be another suggestion. They both work by the same mechanism. And then I think a good assessment of how much spasticity and whether an anti-spasticity medication like baclofen would be helpful.
I'd like to add that you might want to try some stretching immediately before you go to bed, or some relaxing, gentle exercise like yoga before you go to bed. See if that affects it.
Great, thank you so much. Another question we have is, what is the duration of the relief with gamma knife treatment? Does it need to be repeated?
That's a question that I would give the very unhelpful answer of, it depends. Both with MS-related trigeminal neuralgia and people with non-MS-related, it really varies all over the board. I have seen people respond beautifully to the first treatment. I have seen about 20% of my MS patients who need to have a second treatment. The real goal is to decrease the amount of medications. To treat trigeminal neuralgia, it can sometimes take an immense amount of medications, which will really give side effects and diminish one's quality of life.
Okay. Another question we have here is MS-related pain typically not associated with activity? In other words, if I have more pain with physical activity, does that indicate that it may not be MS-related?
I could start with that, or Susan?
I was going to bring up that just because you have MS doesn't mean that you don't get to have other ordinary wear and tear pain issues as all of us age. So you may indeed have something else as well, like arthritis or something that could be.
And did you want to add to that, Dr. Miller?
Yes, I agree. And also looking at the surface that you walk on, and an analysis of muscle tone and posture may pick up something that would be amenable to a simple solution. If you have even a minor foot drop, sometimes that makes one engage the hip muscles and the hip girdle. Ligaments can become painful from overuse.
Great, thank you. Another question we have here, and this goes back to the mattress question. This person is wondering what type of a mattress. If there are suggestions for what would be the best, like a latex, soft, hard, sleep number. I don't know if you all would like to give some feedback on that.
I would suggest that you, if at all possible, that you try the mattress before you buy it. Whether that means some different hotel chains have like Tempur-Pedic mattresses, or maybe your best friend has a sleep number bed and will allow you to sleep over some night or whatever. Try it before and find out if it works for you first.
I think that's a good idea. They just, no matter what kind you have, they wear out. And the important thing is to lay on them and see if they work. But I think, as was said, some of the hotel chains have really good mattresses at not too bad a price. So check them out.
Great. I appreciate that. Let me see here. I believe this is another question with the gamma knife. This is radio frequency, and I apologize if I'm mispronouncing this, rhizotomy?
Rhizotomy?
Thank you. My apologies. And this person has question with this procedure as with MS. And I don't know if
hey, I'm
maybe
a
this is a question.
psychologist. I'm not interested in that one.
If this is a question for Janice.
Sure. Let me make sure I'm understanding the question. Is it always related to MS, and how do we sort that out? Anyone with a new trigeminal neuralgia deserves an MRI with fine cuts through that area of the brain stem. That will help a neurologist, a neurosurgeon, a radiation expert really evaluate what structural or intervention approach might be the best recommendation.
Wonderful. Thank you so much for taking on that question. An additional question that we have is an individual who says that after long periods of sitting, or for example car rides, maybe some suggestions with pain due to sitting for so long. This might be a Susan question.
First, I would suggest that you look critically at the way that you're sitting in the car and see if there's a way that you can change the way the seat is adjusted, or bring a number of small tea towels, kitchen towels with you, roll them up and make a little towel roll that could go in your lumbar spine or go behind your shoulders or whatever to make your posture more straight. And my other suggestion would be to don't sit for a long time. In other words, if you're going for a long trip, after an hour, get out and stretch your legs and walk around the car and take a break for even 5 minutes and then continue.
Wonderful. Does anyone have any addition to that? All right. Thank you so much for taking on all of these questions this evening and for the presentation. And I'd like to thank all the participants who joined us for this webinar. We had a wonderful turnout, and we're very excited about the upcoming webinars. The next webinar is on April the 10th at the exact same time, 8 p.m. Eastern Time. The topic is using adaptive equipment for exercise. And we have a completely new format for our webinars. 2 to 3 experts present, 1 topic for discussion, 0 charge to you. So join us live from the convenience of your home or office at no charge for an in-depth discussion on topics relating to exercise, nutrition, communication, symptom management, and total health. This unique webinar series will provide insight from more than 1 MS expert, so you gain additional knowledge relating to multiple sclerosis. Interact with our team of Can-Do MS consultants, ask questions, and learn how to adopt healthy lifestyle behaviors, actively co-manage your MS, and live your best life. You can register for this and other webinars at www.mscando.org. For those participating live tonight, as soon as the presentation is over, you will see a survey appear on your computer screen. Please take a moment to complete the survey and help us continue to improve our webinars. We value your feedback and input. Thanks so much, everyone, and have a wonderful evening.